Hello, my name's Katrina Arceo, and I am a nurse from Florida, also a wife of one and a mother of two. I actually have a lot of concerns with my face. Unfortunately, growing up, sunblocks and moisturizers were never part of my routine, as embarrassing as it is to admit that. But because of that, I never invested in so much with time and effort with skincare. And so now, years later, at 54, as you can see, I am now suffering the consequences of my inaction with skincare. So I'm excited and looking forward to what Dr. Contessa can do to help and make magic with using her fingers and the technology that she is an expert with, so to fix this. Dr. Contessa, we go way back. I have been friends with her from our teenage years. So that was probably like maybe 10 years ago. so anyway, yeah, but even way back then, I already have seen in her great potential, and I knew she would go far, and I was not wrong. So I've heard great things, and I've seen great things with what she has been and still is doing now, and I'm very proud of her. I trust her explicitly, so no fears. I'm excited and looking forward, like I said, to what she can be able to do to help me. Don't forget to subscribe and click the notification bell.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest. She came all the way from Florida, USA. Let's all welcome Ma'am Katrina Arceo.
Hi.
Yeah. Correct ba, Ma'am Katrina, Florida?
Yes,
Oh, yeah.
Florida.
Okay.
Yes.
So how are you?
I am doing great. Actually, like I said earlier, I'm so excited. Lalo na if I'm gonna put my hands, my face, my skin in your expert hands, I'm good.
Ako, parang ako doon
No, really.
Na-pressure ako.
No,
Anyway.
no.
So, for Ma'am Katrina, actually, I was doing an assessment on her a while ago, okay? So, looking at we divide the face into 3 parts, upper, middle, lower third. And when we check on the upper third, we actually check on the forehead. Do we have lines, wrinkles there? Also between the eyebrows here, if we have these vertical lines there. And it seems like there are. Okay.
Oh,
so,
yeah.
well, how young are you again? Golden girl. So we're in our golden age, okay? So we expect some of the development of the lines and wrinkles there, especially on the upper third of the face. It's because of the constant muscle movements. So every day we do facial expressions, so the muscles will pull in the skin inwards, and constantly doing that every day. So on the skin layer, on the dermis, we have some collagen fibers. They're being torn. Napupunit sila.
Okay.
So they create these so-called static lines. And so we'll see na horizontal lines or vertical lines here because of that. Okay. Everyday facial expression. Kaya iba parang, I don't want to do facial expression, so I don't want to get wrinkles, okay? But of course, every day, especially with your kind of job, you have to do those movements of your muscles, right? So you'll also see on the corner of the eyes, the so-called crow's feet. So those are the things that we check on the upper third of the face. And apart from that, we also look at the position of the eyebrow. Because as we age, okay, everything goes down, full of gravity as well, right? The descent of the tissues, because some of the ligaments, the soft tissues, they become weaker. So these are soft tissue attenuation. And even the bone structure, as we age, there's bone resorption, okay? So on the temple region, you can also see some people having hollowness there. And you'll already see some prominence of the bony landmarks, okay? So you'll see some of the temple fusion line there and the other landmarks that we see on the upper third. So yan ang tinitignan sa upper third. Even the eyelid, di ba, as we age, it droops down. Yun. Now, going to the mid-face section, we check on the under eye area. If you notice, some people have this puffy eyes, eye bags, or tear trough, sunken, or dark circles. And then also like lines and wrinkles there. And when you check the mid-face, this one, the cheek area, as we age, it becomes like flat. And then it also descends, going downwards, or it slides downwards, creating a deep nasolabial fold. So some people, you'll have this, like, you'll see some deep nasolabial lines, or the others are calling it laugh line. So there you go. So, and then the others you'll see, they have a deep groove here, a mid-cheek groove. So something is like sunken there. It's because of the ligaments, they are becoming weaker and the soft tissues go down. And the others, you'll see hollowness on the part here. So that's in the mid-face. And the others on the nose, even the nose will age. So you'll notice the nose will also go down like that. So it's like drooping also. And then creating like a widening effect on the nose. And then on the lower third of the face, naku, dami pala nun, no? The lower third of the face, so you'll notice like the downturning of the corner of the mouth, okay, and the appearance of a puppet line or marionette line, and then the jowls, okay, and then you'll notice the jawline, kind of no more definition, and you'll notice like irregularities there, becomes loose, saggy, it droops down. And the chin may recede, okay. So some people have already a beginning like bone resorption here. So you'll notice the chin is already like going inwards like that. So yun, pati lips. Lip inversion, loss of volume, loss of contour, okay? And wrinkles around the mouth. So the others you'll notice they have this kind of like smoker's line, or the others call them barcode. So many things like the aging process happening on the skin structure, and not only on the skin layer but inside, the tissues inside, up to the bone. So the fats, the muscles, the ligaments, the bone, there's aging. It's not only on the outer, on the envelope, the skin layer. And when you go to the neck also, yan, mga bulges here, yan, mga platysma bands, the neck wrinkles, loose skin, yan, mga lines, wrinkles, we see all of those. So, dami pala, Katrina.
Marami.
Pero, in fairness, Katrina is like early 50s. So, I was telling her, like, I have patients in that age, but, you know, you can differentiate. But probably, Jeanette, in your genes, you have this, like, tendency not to age faster, okay? Diba? In some parts of the world, you'll notice, like, we have the same age, but how come they look older than us? We Asians, we Filipinos, because like you work in the US, I'm pretty sure you're like same age as yours. They're like comparing themselves to you, right? And you're not doing that much, right? You're just like, you know, living naturally, living healthy, having a healthy lifestyle. Yeah. So also your genes are very good. So may factor kasi yung genes din eh. And ethnicity eh. I think we Filipinos, if you look at our, like, you know, our appearance, our face, kind of, we look younger, right? Yeah. So advantage, yeah. Oh my gosh. So, but I don't, actually, we don't need much of a procedure on Ma'am Katrina eh. Like a microdose of like a relaxing dose of a Botox, skincare, yan. Because with Katrina, what I'm seeing on her, so on the upper third, of course, there are like fine lines and wrinkles already. On the mid-face, more of the, yan. I also make age spots. Like sunspots, okay, some pigmentations, they occur as we age also, okay? We have some hormonal spots there. So you'll notice solar pigments there, okay? So we're seeing those dark spots there. And then like open pores. So as we age also, the skin becomes thinner plus dehydrated because we lose also not only collagen but hyaluronic. And hyaluronic attracts water. It keeps the skin well hydrated. Yon. So what we're going to do for Ma'am Katrina today is more of an improvement of the skin quality, the outer layer, the skin envelope. We want to, like, you know, reduce those pigmentations, close the pores, tighten the skin from the skin, stimulate collagen, elastin, and all of those, all of the above na, including the neck na. So Ma'am Katrina, what kind of procedure, what treatment? We'll show you when CSA Medical Aesthetics returns. And we're back. So we're doing a treatment for Katrina, and actually also a while ago we were discussing about the moles on her skin, okay? So first, this is something that we inherited, right? So these are nevi, okay, the medical term. Then I was sharing with Katrina a while ago that, you know, in Korea, like these kinds of like moles, for them it's a skin imperfection, okay? They really want the skin flawless, no spots, no anything. They just want it like smooth, clear of anything. Yeah, clear of pimples, clear of scars, clear of marks, clear of lines. There you go. So we're also like recommending, like especially this one under the left eye here, we can have a removal of this one. Although in my assessment it looks benign, okay, because you know the borders are smooth, and then it's not asymmetrical, it's not irregular, it doesn't look bizarre, okay. And when I ask you, is it growing, you mentioned that the size remained the same, right? But it's also best to have it removed, okay. And we have lasers here that we can remove the moles without like a mark or a scar. Okay, I'll start with the so-called Eladerm, and Eladerm is a radiofrequency microneedling device. This one is not a laser, okay? So when you say laser, laser is an acronym actually, Katrina. It's a light amplification by stimulated emission of radiation, theorized by Albert Einstein. Okay, ang galing. So that's science. So this is microneedling. So when you have microneedling, it's like reaching the dermis of the skin. We want to create microchannels for our solutions later on to enter or, you know, be infused in that dermis layer. We want them inside the dermis layer, okay? So I'll start with doing the right side, okay? So this is painless, Ma'am Katrin, because we're using the cryogen spray also, okay? I'll do a one shot here on the chin part here, just a testing. How's that?
Oh, it's good.
Yeah, because it has the cryogen spray. So that's also like giving you like an anesthesia effect, okay? Although a while ago, we have a numbing cream. We left a lidocaine cream for like an hour, right? So that will also reduce any sensation, any like, you know, we want to inhibit the sensory nerve there. So I'm just going to proceed with this Eladerm here. So again, this is radiofrequency microneedling, okay? So it has a certain like temperature, heat temperature, an optimal temperature that we need for an effective collagen synthesis, okay? Do you feel that?
Oh,
there's something like a
baby
pins?
Yeah.
But it's something tolerable, right?
Oh, very, yeah.
Okay. So the good thing with this device, unlike other radiofrequency microneedling device, they don't have the cryogen spray. So this is the only device that has that. So you can hear the spray, right? So it also has the so-called like micro pins, okay? And those micro pins penetrate up to the dermis layer. So actually the dermis, it's the layer of our skin where we have those cells that will make your new collagen and your new elastin and other like extracellular matrix proteins. That's why we need to go to the dermis layer. Because the epidermis is just made up of like different kinds of cells. Okay, like you've heard of the stratum corneum, yan, mga stratum granulosum. Alala mo pa yun, Katri? Stratum.
Yes, I do.
Yan. Spinosum, stratum basale. So, there you go. So, after our Eladerm or your radiofrequency microneedling, so we're just doing the half first, okay? And then we'll infuse with our so-called NCTF, okay? So, this is the new cellular treatment factor, okay? So, we're gonna disinfect the skin again, okay? So it's good to combine this kind of device with this revitalizing solution. So NCTF has 135 components together with amino acids, vitamins, minerals, hyaluronic acid, and all the micronutrients that we need. Micronutrients, Ma'am Katrina, hindi mga macro, so micro. So we'll deliver it just in the dermis layer. Ayan, dermis layer na naman. I'll start working on the lower, then mid-face, and then upper, okay? So this is just a tiny tricks lang. So actually, I'm using the so-called 234 needle. So it's gauge 35, 2 millimeter. And we want to deliver it in the dermis layer. So this is a best treatment right now for skin revitalizing. So if you want to deliver, these are the skin peptides. I remember like one inquired about skin peptides. She was asking me, Doc, do you inject skin peptides into the skin. And I said, yes, we've been doing the injections of amino acids and peptides. What are peptides, right? So when you say peptides, these are chains of amino acids, short chains of amino acids. But if you have like more than 100 amino acids, then we call them proteins. Yan. Peptides, we have the so-called dipeptides, tripeptides, oligopeptides, biochemistry. I teach biochemistry, and peptide chemistry is always my topic. So we also have polypeptides. There you go. So the amino acids are in your peptide. So ito, may mga laman siyang amino acids. And the essential amino acids that we have, actually right now, there were like around 22 amino acids in the human body. Okay? So review nga natin, ano lahat ng amino acids? Biochemistry. So we have the neutral amino acids. You have your glycine, alanine, valine, leucine, isoleucine. You have the basic amino acids, yung meron silang high pH or alkaline amino acids like your histidine, arginine, lysine, yung mga med students ko, alam nila. And you have the acidic amino acids, low pH amino acids, your aspartic acid and your glutamic acid. And we have the aromatic amino acids, yung mayroon silang chains or like rings in their side chains. Ayun, mga side chain amino acids. We have the tryptophan, we have the phenylalanine. Remember phenylalanine sa phenylketonuria? Meron pa silang tyrosine. Yan. Tapos may sulfur-containing amino acids, methionine. Ay, dami. And cysteine, cysteine. Tapos meron pa siyang ornithine. Tapos meron pa siya ng mga threonine. Yung mga branch chain amino acids, I've mentioned, valine, isoleucine, leucine. Yan. So, meron pang proline. Proline is the amino acid that we call an amino acid. Amino acid, yan. So, ang dami pala, Ma'am Katri. So, I'm also injecting into the forehead region. So, later on, I've mentioned about the lines and wrinkles. I'll be adding Botox pala. Wow. Yan. You've heard of the Botox, right? Now, Botox or botulinum toxin is also made up of chains of amino acids. Meron siyang light chain and heavy chain. So, lahat ng mga to may scientific basis, no? So, later on, I'll include the neck area also with this NCTF. Okay. So, since I'm doing the right side, I'll continue with my microdose of your botulinum toxin, which has light chain and heavy chain of amino acids. Okay, so the action of your botulinum toxin, it will inhibit your acetylcholine to be transferred to the terminal area of your muscle so that it won't contract. Okay, so meron siyang ini-inhibit na neurotransmitter. Yan. And the neurotransmitter is your acetylcholine. Okay, so konti lang. And then we'll also work on the wrinkle here para wala nang, they call it once. Yan. You're good? Tolerable, right?
Yeah.
So again, I'm using a 2mm needle. This one is a gauge 32, right? A while ago, we used the gauge 35 for the NCTF. So again, NCTF is a new cellular treatment factor. It contains a lot of amino acids, vitamins, minerals, glutathione, and other micronutrients. Lahat nandun na. So it will revitalize your skin. Okay, let's proceed to the left side. So we have done multiple treatments for Ma'am Katrina. We did Eladerm, we did the NCTF plus the botulinum toxin for the upper third of the face. We'll show the results when CSA Medical Aesthetics return. And we're back. So let's show the result to Ma'am Katrina. Yun lang, multiple injections, cutaneous injections, minute injections, micro injections lang naman. So it's expected. Of course, we did the Eladerm RF microneedling. They have micro pins. We also did the micro injections of your NCTF, your new cellular treatment factor. We did the intradermal technique there. But we used the gauge 35 needle only, like a 2 millimeter length. Then we also did the microdoses of your botulinum toxin on the upper third of the face. We already included the neck part, okay? Never neglect the neck. Don't neglect the neck, okay? Forget me not here, this part here, so that everything is balanced, okay? Now, we'll also be working on the mole on the left side, so left infraorbital area. So this one here, we'll have it removed later on. We'll be using our CO2 surgical laser for removal. Or you can also use electrocautery device. Plus, I would recommend doing like a histopathology for that one to make sure it's really a benign pigmented nevus. Okay. So, Ma'am Katrina, how are you?
I'm doing fine, actually.
Right.
I barely felt it. Yung ganun, parang baby, lang. So, and ang bilis. At saka, I appreciate you explaining everything.
Exactly.
Galing.
Yeah. And everything is scientific, okay? So, there are studies with these kinds of treatments that we're doing. We only do evidence-based or studied treatments, okay? And even the products, they should have this FDA approval, they should have this clinical papers, you know. That's the practice of medicine. Because right now, Ma'am Katrina, in the Philippines, there are like non-MDs performing like procedures in aesthetic medicine, okay? So, we want to advise our like televiewers to, of course, go to your aesthetic doctors, aesthetic physicians. They're more, you know, experienced and also trained to do all these kinds of procedures, especially those injections, okay? Because in the Philippines, we have a law, the Medical Act, that for injections, okay, it should be performed by licensed physicians, okay? Although we have nurses with us, they can do some injections, but they're supervised by the doctors. Yan. So, warning lang po sa ating mga televiewers. Yan.
Very important.
Okay. Any like message or anything you want to share to our viewers?
I would really recommend Doctora.
Yeah.
So, you know, and like what she said, to just kind of like second on that, really like the face you never entrusted to just anybody. That's very important, your face. So, but with Doctora, I am 100% trusting her and I didn't make a mistake.
Thank you.
Thank
Especially
you very
with the botulinum toxin, okay? There are also non-MDs performing it, okay? But those working in medical fields, like mga nurses, nurse practitioners, okay? They're also well-versed with the anatomy of the face. Because the botulinum toxin, okay, it's made up of amino acid peptides, okay? But if you inject it incorrectly, there's certain muscle that you have injected it. It could lead to a paralysis of a certain muscle. For example, you're injecting on the sides of the eyes, or on the under eye, and you suddenly inject a muscle that's connected to your corner of your mouth that will like lift your upper lip when you smile. So it will lead to paralysis of that, and when you're smiling, you might have the asymmetrical smile. So there are some dangers in doing your injection of your botulinum toxin. Plus the dose, these are like micro doses, small doses that will not cause any like, you know, permanent paralysis, okay? So the muscle contraction will still resume its normal activity over time. Because this one will only last, like, we always say 4 to 6 months, okay? But so for some individuals, like, some individual variations, okay? Like the peptides are easily metabolized or degraded. I have some patients like 2 to 3 months, the action of the muscles are already active again. So there's also like individual variation in terms of the response to the medicine, okay? So with this one, we could say like you can do botulinum toxin injections like twice a year, every 6 months, or the others 3 times a year, depending on like the severity of the problem. Now the Eladerm, it's a good device also. Like this device, we also need like a repeat treatment of that one, okay, to really improve the quality of the skin, to stimulate collagen formation, and a lot of the benefits from that one. Plus the NCTF, you can still do that. So it's like food for your skin and making your skin looking healthy, glowing, okay, radiant, okay. Plus, yun, tight and firm and youthful all the time. Thank you, Ma'am Katrina. Okay.
Oh, thank you very much.
So, we'll still do the mole removal, okay? We'll just like insert some of the video on that, and then we'll still share the after photos, like after a week or 2 weeks, we can share it to our televiewers, okay? So, any social media they can follow you, or you're okay with that?
I am not really too much into social media,
Yeah.
so
Because some of our viewers, like, they want to see the outcome, and
Oh, yeah,
they follow
actually, yes.
our,
Okay.
yeah, they check on, oh, how is she right now? Is she looking better? Something like that. They check on their, like, Instagram, social media. Katrina Arceo, right?
yes, Katrina and RCO.
There
Yeah,
you
yeah,
go.
at least
Okay.
Facebook, I have that one.
Correct. And you can also follow us at our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. If you have any questions, just email us at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Our contact number 0933-860-9193 or 0917-504-4268. Ang dami kasi nagtatanong saan daw ang location, ano pong contact number ninyo, yung mga ganon. Okay? So, also please watch our other videos at our YouTube channel, Contessa Salvador. So, thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.